Up next, we're going to have a presentation from our Vice President of the TBRS community, Kerry Grens, and she'll be speaking on our most recent patient priority survey results. Kerry Grens is the mother of 3 amazing children, the youngest of whom was diagnosed with TBRS in 2019. Since 2020, she has been the Vice President of the TBRS community, where she serves as the Medical and Scientific Advisory Committees and contributes to outreach, education, events, and the Collaborative Research Network. She works at Washington University as the Marketing Director for the Department of Neuroscience. And I'd like to welcome Kerry to the stage.
Thank you so much for this absolutely inspiring and illuminating day of science. So we will get to the panel discussion next, and then all of the fun with our families arriving this evening. But first we'll go through our patient priorities. So if you have joined us for our Collaborative Research Network meetings in the past, we present our patient priorities every year, and now I am here with a new and improved edition. And that is because it was developed with the new organization called the Overgrowth Syndromes Alliance. Earlier this year, the TBRS community and the Milan Syndrome Foundation, another patient advocacy group for an overgrowth intellectual disability syndrome, had a baby called the OSA. This baby gestated for a couple of years in conversation, but finally took its first breath. And the mission of the OSA is really to align research around patient priorities of overgrowth intellectual disability disorders, and to push research in directions that are going to meet those greatest unmet needs. So a first step in that direction is to gather our patient priorities. And so we modified the survey that we had created in the past for the TBRS community and what Milan Syndrome Foundation had distributed to their community to make a meaner, sleeker, and hopefully more insightful version. It was 12 questions, and contact information was optional, although I will say the vast majority of people provided their names and emails, so we have this enormous directory of people who are excited to participate in research and have their voices and perspectives heard. We sent this out to the OGID community, family community, for a month. We had to cut it off just to have time to get our presentations ready. And it was primarily distributed through patient advocacy organizations. We sent it to our IRB review, North Star, and they took a look and said it didn't need review, which was very nice. We didn't have to go through all of the review for our distribution and advertising and things like that. So very quickly, I'm going to give you the aggregate results, but I have a poster on all of the different syndromes that participated in their top five priorities. What I will focus on for the next few minutes is just going to be the TBRS results, but I'll tease the aggregate first. And thank you so much to Kit for all of your work in nursing our baby, and to Justin Dion for some data analysis support and prep for the survey. We have now at this point more than 400 respondents. Each of those are representing a single individual diagnosed with an OGID. So this is a really loud patient voice here. We have more than 400 because the survey is open. It will remain open indefinitely, but at the point when I cut off the data, we had a little less than that. As you can see here, this is a very motivated community of people. 88% would be interested in participating in a clinical trial. Keep in mind the vast majority of those respondents are caregivers. I just want to hammer home the point that hundreds of people here are willing to work with you, and they want you to know what's important to them. And we have, like I said, the contact information for the vast majority, so we can follow up with them and, present opportunities to take part in research. So the average age, I need to look over here instead of up there. 13 years, and you can see the breakdown. So Milan, SOTOS, and TBRS were each about 30%, followed by PIK3CA-related overgrowth spectrum. There's some MCM in there, Clove syndrome, Smith-Kingsmore, and then two respondents who were representing individuals with Weaver syndrome. So again, poster over there for all of the different syndromes broken out, but I will focus on TBRS. Here we had more than 100 people respond. So last year it was in the 60s, so this is a big jump in participation here. Average age is 16, a little bit older. There's our age distribution. We had 2 individuals who are 44 years old, so this is great to see some of those adults. We don't have tons of adults in our community, but we do see that they are taking part in this survey. Again, enormous interest in research, and all of them reported that they did have a confirmed genetic diagnosis. We did not confirm this ourselves, but they just checked that box that they did. Here's my weighting. I'm not going to go through it very long. You can ask me about it afterward, but the question that I will focus on the results here for is, which symptom is your highest priority to find treatments for? And the total for the TBRS respondents, just like we've seen in the past, those cognitive functions, intellectual disability, behavioral and mental health, and communication are at the top. And then, unlike in prior years where we really saw the musculoskeletal functions as a high priority, we see obesity and cancer. Just like last year, no 2 people answered in the exact same order, which I think is, validates the responses here, except for a mom who was responding for 2 of her girls and obviously had the same priorities. So what is very important to us is to be able to capture the direct perspectives of individuals living with TBRS or living with an OGID. We had 2 in our group. There were 7 overall in the entire survey, and you can see their responses here. Obesity, orthopedic and joint issues, intellectual disability, GI issues, which doesn't come up too often when I was looking at these results, and then immune issues there. And for the other individual, this person was aided in responding to the survey by her mom. ID, pain, obesity, orthopedic and joint issues, and behavioral and mental health were their top 5 priorities. I want to just point out that pain is something I would love us to focus a bit more on, because when I looked at the responses of the 7 individuals who had been diagnosed with an OGID, pain was in their top 5 priorities. I don't think we fully understand the experience of pain, at least for people with TBRS. I think a lot of us caregivers consider it, people with TBRS to have a high threshold for pain, but I don't fully understand how my son experiences it. This person, that's a high priority for them to have treatment for. And for those other individuals who responded, it was also in their top 5 priorities. So this is something I think that there's a signal there that, we should pay attention to. I'm going to go through a few different age groups. So for our little ones here, and I'm just going to point out where they deviated from the top 5 priorities of the 107 TBRS respondents. So in this case, it's mobility was unique to this age group. Not surprising, right? A lot is focused on helping those little ones learn to walk. They're slow to get there. It's intensive with physical therapy and orthopedics and walkers and everything. So that's not too surprising there. Our school-aged kids, seizures emerged as a priority here. Our teenagers, we see orthopedic and joint issues coming up here. Our young adults, cardiac issues. And for our adults over age 30, orthopedic and joint issues, and again, cardiac issues. Dr. Vicken Totten has a really excellent poster over there on aortic root dilation in people with TBRS. She's collected, quite a number of cases there. And as we saw from Dr. Tatton-Brown's talk this morning, cardiac issues are really prevalent in TBRS. So what we're doing now is trying to spread the word far and wide about the Overgrowth Syndromes Alliance. I would love all of your feedback about it. Eric had brought it up that there is some, lack of consensus about how we go about as a cluster of OGIDs, moving research that might sort of target underlying biology all at the same time. And some of the talks we heard today, I think, would argue for that approach. And then, of course, there are those who think that TBRS could be better served by focusing on it individually. So I would love to talk more about this while you're here. But in the meantime, we are sharing these results. At the CZI, Kit and Jill were there, and then immediately after this, they're flying to Nord, and they're going to have a poster there, and then, of course, I'm sharing this now. The survey is open, so whenever we have an opportunity to present to the community, we will reanalyze the data. We want any new individual or anyone who's just heard about this survey to be able to share their voice. We're not going to close it out. We really want to expand the number of individuals diagnosed with an OGID in these surveys. So Jill and the other OSA folks have been talking about having one-on-one meetings where we sit down with the diagnosed individual, go through the survey with them so that they can take it, or having pictures as prompts to help them complete the survey, translate it into multiple languages. At our patient advocacy group meetings for the OSA, we had groups from Italy and Spain there. We do not want language to be a barrier. That is something that can be easily addressed with a little bit of funding, which we have none of right now. So just planting that seed as well, that we would love to eventually be incorporated as a nonprofit, get some funding, get a website, and accelerate onto a meeting, hopefully next year virtually, and then maybe in person in 2025. So just some questions that have come to mind as I've been working on this, and that we can talk about at the panel or over dinner tonight. Breaking it out into different age groups, what can we learn about the progression of TBRS? As we had seen from last year's patient priority survey, one of the top questions is, what will the future hold? That's a huge concern for caregivers. And so if we can give some expectations, especially for newly diagnosed families, that would be, I think, wonderful for them. And then, how can we use these results to motivate research? So thank you very much.
Perfect.